Members, good afternoon. We have a quorum. I call to order the meeting of the Special Finance Committee. The meeting will run until the 5:55 this afternoon. The meeting is to examine the estimates of expenditure to ensure that the government is seeking a provision no more than is necessary for the execution of the approved policies. All the questions must be directly related to the written supplies provided by the administration. Please quote the reply serial number LWB-W. If members can follow up on the written replies given by the administration, you can send your supplementary questions to the Secretariat before the end of the meeting. They must be directly related to the administration's written reply. We welcome Secretary for Labor and Welfare, Mr. Chris Sun, to the meeting today. This session is on welfare, poverty, alleviation, and children. Members who would like to speak, please press the button. Thank you, Chairman. Thank you, members. Good afternoon. In 2024-25, government recurrent spending on social welfare is estimated to be $127.4 billion, accounting for 22% of the total recurrent government expenditure of this year, first amongst all policy area groups. Compared with the revised 2023-24 estimate of $112.4 billion, recurrent spending on social welfare goes up by $15 billion at about 13.3%. Now, let me highlight how the Labor and Welfare Bureau, LWB, will make use of these resources. The recurrent government expenditure on elderly services this year is estimated to reach about $16 billion, representing an increase of about 60% over about $10 billion comparing to 5 years ago, that is 2019 to 2020. The government will continue to strengthen residential and community care services for the elderly, adding 1,000 more residential care service vouchers for the elderly RCSV and 1,000 more community care service vouchers for the elderly CCSV starting from the second quarter this year, so that RCSV and CCSV will have a total of 5,000 and 11,000 vouchers respectively. Starting from the second quarter this year, the service scope of RCSV will be extended from the existing care and attention places to nursing home places. This year's budget proposes providing an extra half-month allowance to eligible recipients of Social Security payments, which will incur an expenditure of $2,873 million and is expected to benefit some 1.66 million persons. Similar arrangements will apply to recipients of the WFA Working Family Allowance Scheme. Some 64,000 households are expected to benefit from this initiative, incurring an expenditure of about $100 million. Apart from this, the government continues to enhance cash assistance schemes, including increasing the rates of household and child allowances under the WFA by 15% across the board, with effect from April this year. The additional expenditure involved is expected to be about $257 million per year. In view of the aging of users of RCHDs, residential care homes for persons with disabilities, the government will increase nursing staff in RCHDs to enhance care for their aging users. The annual expenditure involved is about $121 million. To meet the needs of day training service users who are aging or have deteriorating health conditions, we will increase service places of the extended care program in day activity centers and the work extension program to enhance care for these service users. The annual expenditure involved is about $20 million. The government will also enhance the services of the integrated community centers for mental wellness, including strengthening early identification of persons with mental health needs and early intervention, and scaling up the training of social workers in community mental health service units to enhance their capacity for handling complicated cases. The annual expenditure involved is over $60 million. We will also seek funding of about $129 million from the Community Care Fund to implement a 3-year pilot scheme from the third quarter of this year to provide an additional subsidy of $500 per month to employed disabled recipients of the CSSA Comprehensive Social Security Assistance as a means of encouraging their employment. In Q4 of 2024, the government will invite recognized service providers taking part in a CCSV scheme for the elderly to provide day respite services for needy elderly when there are vacant service places. The annual expenditure involved is about $24 million. The government launched Community Care Teams pilot scheme on supporting elderly and carers, the pilot scheme in March. Piloting in Chimwon and the Southern District, the care teams will help identify households of singleton or doubleton elderly persons, as well as carers of elderly persons and carers of persons with disabilities requiring support, and refer cases to the relevant social welfare service unit for follow-up. Care teams will also assist referring needy households in installing emergency alarming systems, that is, safety bell. The expenditure involved is about $9 million. Upon reviewing its effectiveness, the government will consider extending the pilot scheme to other districts. In April 2024, the SWD set up a designated team in each of the 21 district support centers for PWDs across Hong Kong to proactively get hold of the carers of special school leavers 6 months before graduation, providing training on caring and interaction skills, arrange post-school care plans in link with community support services, as well as provide follow-up services for needy cases after graduation to facilitate school leavers' smooth transition from school to community life. The annual expenditure involved is some $110 million. To support persons in mental recovery and their carers, the government will strengthen peer support services in 2024 and set up 4 additional parents or relative resource centers for carers of persons in mental recovery in 2025. The annual expenditure involved is about $26 million. Over the next few years, starting from this year, the government will set up 10 more aided standalone childcare centers in phases, providing some 900 additional places for day childcare services, and starting from this April, increase the childcare center parent subsidy. The SWD will also extend the after-school care program for pre-primary children to cover all districts in Hong Kong. The service places will go up to nearly 1,200. Starting from this April, the incentive payment for home-based child carers of the neighborhoods Support Childcare Project will be increased, and starting from the fourth quarter this year, doubling the number of service places to about 2,000 to double the number of beneficiaries to 20,000. The various initiatives above will involve an annual expenditure of about $408 million. The government is fully working with LegCo in its scrutiny of the mandatory reporting of child abuse bill and looks forward to the early passage of the bill and the implementation and look forward to the early passage of the bill. Relevant additional full-year provision by the government is about $186.5 million. I understand the $2 scheme is a bone of contention in the community. Everyone is cared about this scheme. The government has stated that there is no intention to cancel the scheme or change the existing beneficiary groups. We anticipate the review will be completed within this year. Chairman, this is my opening remarks. Members are welcome to raise questions. A total of 26 have requested to speak. We can only allow 23 members to speak, according to my experience. It depends on the time that each member will take. Please at least allow some time for the administration to reply to your questions. If the administration does not have enough time, then they will send you a written reply. Members are in order: Dr. Tik Chi Yun, Mr. Ma Fong Kwok, Mr. Michael Tian, Professor Lau Chi Pang, Ms. Doreen Kong, Dr. Ngaman Yu, Ms. Yung Ho Yan, Ms. Maggie Chen, Mr. Lam Chen Sing, Kenneth Leung, Bill Tang, Adrian Ho, Dominic Lee, Chen Siu Hong, Ms. Nixie Lam, Connie Lam, Mr. Stanley Lee, Dr. Wendy Hong, Mr. Chen Pui Lang, Chu Kok Kang, Andrew Lam, Dr. Hui Simon Lee, Ms. Chen Ho Yan, Mr. Chao Siu Chung, Mr. Lai Tong Kwok, and Mr. Chen Yong. I hope members will manage time well. Let's start with Dr. Tik Chi Yun. Thank you, Chairman. In all sincerity, I have to thank Mr. Chen for reminding me to press the button. I'd like to follow up on the question 205. In the budget, $2 billion have been earmarked for buying social welfare facilities to enhance service. Of course, I support this. If we have space, then we will have services ready. In the written reply provided by the administration over the last 4 years, $240 million were used. Only 5 properties were bought out of 6, according to the plan. This is mind-boggling. Is it the negligence of the staff, or is the program not a successful one? I'd like the administration to let me know what happened in these 4 years. The property market is is lacking. It's not doing well. In this financial year, 2 non-director positions and 5 non-direct positions in the GPA are responsible for buying land for the government. A total of 7 senior officers are doing this task. Can the administration explain to me, in the coming 1 to 2 years, will we be expecting good results? About the 1% cut in the social welfare sector. For large organizations, 2%, and this will be delayed by 1 year. I understand this arrangement is itself good, but when I talk to large-scale organizations, it's kind of difficult for them to recruit people, so they have some time left. But when manpower resources have stabilized, when social welfare organizations need to cut its staff size by 3%, this will be quite a heavy burden. The funding will have to be cut by 3%, totaling 6% to 7% over these few years. So our resources have been cut by almost 10%. If the expenditure is still going to be cut, our services will be affected. For example, can the administration let me know the cut will be cancelled or shelved a couple of years later? Secretary. Thank you, Chair. Thank you, Dr. Tick. Regarding the plan to buy service places, we are doing our best. But I hope members will know that there are many restrictions, such as height restrictions for children, as well as other restrictions targeting elderly people. So when we need to meet all requirements, we are already doing our level best. Social welfare organizations are very much concerned about adding value to resources. We met members very quickly after the announcement on the budget. The LWB could not solve all the resource issues solely by our bureau. It's impossible. So we need to solicit support from other NGOs. $50 million. Well, these social welfare organizations will not be subject to the impact by the 3% cut. Starting from the next financial year, adjustments will be made according to the plan announced by the Financial Secretary. We think this is actually the best method among all of the options. Next, Mr. Ma Feng Kwok. I'd like to follow up on my question. Reply LWBW 166. That's about residential care service for the elderly people. There will be an additional 1,000 RCSVs to a total of 5,000. So a wider range of elderly persons can apply for these vouchers. I'd like to know the number of elderly persons on the on the register. Normally, how long do they have to wait until they can have the vouchers? By how long can the period be shortened? I hope it won't take long for elderly people to get the vouchers or get a place. And I understand this scheme is actually not applicable to elderly persons on another scheme. That is the portable scheme. I understand this scheme is meant to be provided to the elderly persons in Hong Kong and is not applicable to the GDRSC scheme. Will the administration consider extending the scheme to those in the mainland?
Secretary, thank you. We have different schemes for the elderly. The elderly will have to subject to standardized assessment. for elderly people who want to queue for care and attention homes or nursing homes, they can register. Most elderly persons choose only one or two kinds of homes, and they would go on the waiting list. If they prefer, say, place purchase scheme, then they can get hold of a place more quickly. What is the benefits of RCSV? Is that the elderly person don't have to wait. They can get the RCSV and they can purchase service from care and attention homes or nursing homes, so they don't have to wait for a place at the subvented RCHEs. They can pay for services offered by private homes. Why is it the case that the RCSV is not applicable to the residential care services scheme in Guangdong? That's because for the Guangdong scheme, that is the GDRCS scheme, as long as they are willing to stay there, they can get a place. They don't have to buy their services with the vouchers. As mentioned by the secretary, for people getting RCSV, they don't have to get on the waiting list. Let me give you more information about the time to get hold of a place at private homes. It's shortened from 9 months to 4 months. As for the waiting time for subvented homes, the time has shortened from 21 months to approximately 9 months. For care and attention homes, it has reduced from 11 months to about 7 months. Next, Mr. Michael Tian. Thank you, Chairman. 4 questions. 193. A lot of parents of kindergarten students ask me about this school-based after-school care service scheme, and they ask me why this is not applicable to kindergartens. And the government said that they will extend it to kindergarten later. Now, I know that the cost for each of the place is approximately $2,750 per month. So I wonder when you will extend the school-based after-school care service scheme to the kindergartens. I would also like to ask about 195, about the designated hotline for carer support. That is the carer hotline. I've met with a number of social welfare groups. Most carers actually want emotional support. They want someone to talk to when they break down in the middle of the night. They want to hear from someone who shares similar experience. They want immediate support. And I proposed the creation of a mobile application like a taxi app or Uber app. The social welfare groups actually support this idea. Secretary Sun this morning said that they are ready to help government departments improving their IT technology. I would also like to ask about 196 for the assessment criteria for NGOs bidding for subsidized welfare services. They said that one of the assessment criteria is if they support the community. And what does that mean? I would also like to ask about the $2 scheme. The main issue is with short rides for long route. There's this problem where people who is going on short rides, they get on bus trips or bus for long haul. I propose a 80% off discount instead of this $2 scheme. So when people take a longer trip, they will have to pay a higher fare. Some people would be deterred from taking bus meant for long haul if we put in place this 80% off scheme. Secretary, please choose 2 questions to address. For the rest, please give them a written reply. For the $2 scheme, as mentioned, we will complete the review within this year, and we will listen to members in due course. And we will share with you our idea after the review. For NGOs bidding for subsidized welfare services, we will see if they have supported the government in their policy execution. That's not really difficult to understand. We want these NGOs to love our country and our city. Let me give you an example. For our National Day, for example, after the 2 sessions, the 20th Congress, maybe the NGOs can organize some seminars for sharing of the ideas proposed in these meetings or seminars. Next, Professor Lau. I would like to ask about 163, about the Guangdong scheme. That is the Residential Care Services Scheme in Guangdong, GDRCS scheme. For the GDR scheme, for the number of elderly participating in this scheme in the past 3 years, there were 144, 52, and 21 respectively. That is 165 in total. Some $33.7 million were spent. That is about 17,000 per person. So will the government be expanding the scheme? Last November, we signed a letter of intent with the Guangdong authorities. Last year, we went to Fuzhou for a visit, and we visited a RCHEs where Hong Kong people actually reside there. I remember that there were some 20 to 30 Hong Kong senior citizens residing there. So why did we only sign this letter of intent with Guangdong last November? In the administration's reply, they said that they will explore the possibility of expanding the scheme to other homes soon. So I wonder if they are just exploring the possibility, or are they actually trying to implement the expansion? And it's mentioned that the estimated expenditure for the scheme in 2024-25 is about $32.5 million. That is actually less than last year. Is it because of our fiscal deficit? And why did you not extend the scheme to other provinces, for example, Fuzhou? Only some hundreds of elderly persons can be taken care of under this scheme. There are some tens of thousands of Hong Kong people who cross the border to receive care services on the mainland. Why is there such a huge difference? Is it because the homes that's available under the scheme is not attractive? Because you've said that you will dedicate about $30 million to the scheme. Is that too little? Secretary. Well, there are a few characteristics to this Guangdong scheme. People eligible for the scheme are those who have passed the standardized assessment mechanism. These elderly persons cannot take care of themselves in Hong Kong on their own, and that is why they're eligible for this Guangdong scheme. For the one in Shenzhen, there are some hundreds of residents. For the one in Zhaoxing, there are some only 20 elderly persons residing there. It may not have to do with the quality of these homes. It could be, well, for senior citizens who want to reside at Guangdong, they don't have to pay a single dollar. They will consider a series of factors, for example, the quality of service and if it's convenient for their relatives to visit them. We want to provide more options for the elderly people. For SHEs in Guangdong that is eligible for the scheme, they will have to be an NGO and they will have to have a business in Hong Kong and mainland. As long as they have, say, bought play scheme experience in Hong Kong, they can join the scheme. And we have relaxed some of the requirements. As long as the NGOs have a place at mainland, we can allow them to participate in the scheme, and we have identified some tens of such homes on the mainland. By relaxing the requirements, we hope to provide more options for our elderly people. We want to improve our services on the Greater Bay Area first before expanding it to other provinces. Next, Ms. Doreen Kong. I would like to ask about 029 and 30. I know that there is peer support services, particularly under 030. In the administration's reply, it is mentioned that the Social Welfare Department does not maintain breakdown of figures on the provision of peer service at each subvented ICCMW. That is Integrated Community Centers for Mental Wellness. If we don't have such a figure, then it's very difficult for us to assess the effectiveness of peer support services. These events could be joined by 10 people or 100 people. Why does the SWB not have such information? I think that peer support is very important, but the expenditure is only some $10 million. Mental wellness is very important to carers. I wonder why the estimate is so low. Secretary, mental wellness is essential to the happiness of the people. We see a large number of suicides every day. They may not be carers, but actually carers are faced with immense pressure. I know that the secretary is already working on it. They have some care for carers campaign for the next 3 years. We have such a serious mental issues with the carers these days. Will the government adjust the strategy? Apart from publicity and promotion, will you provide them with some solid and concrete support? My last question, 007, about the Shine Skills Center. I've looked at the employment situation with the graduates. For assisted employment, only 7.1%, open employment 28.6%, training at sheltered workshops 1%, which means that some half of these graduates don't have a job. Will you encourage the private sector to hire graduates from the Shine Skills Center? Secretary. Thank you, Ms. Khan, for the question. Under the ICCWM, while peer support is very important, I have visited a number of these integrated community centers for mental wellness. Peer support service is very important. That is why we have increased the resources dedicated to such a center. Peer mediators, it's a very important grade, and that is why we have opened such a job under the center. We do not ask the peer mediators or peer supporters to provide us with much information because we don't want to increase their burden on their administrative work. If you want more information, I can ask them for it. I know that the member is concerned about the number of suicide cases. Under the Care for Carer campaigns over the years, we want to make members of the public aware of the difficulties faced by the carers. If you've come across carers who need help, you can relay them to the relevant departments. For the graduates of Shine Skill Center and their employment situation, we want to help and encourage our private sector to join hands with us by providing more job opportunities for graduates of these centers.
Next, Dr. Ngan Yu. Thank you, Chairman. I have two questions. One on reply 232. That is about the establishment of an office. Has the administration considered using technology to enhance the approval mechanism in the Working Family Allowance Office, WFAO? My next question is about 172. There are some 2,456 places and 104 are waiting. They have to wait for 19.3 months. What the administration will do in order that these children with special education needs will not have to wait for such a long period of time before they can secure a place. Mr. Zhang from the WFSFA. As we mentioned in the panel meeting, we have been identifying solutions to leverage on technologies in order to streamline our procedure. We are trying to encourage online applications. 2 years ago, there were only 20% to 30% of applicants who made online applications. After publicity, now as many as 50% of the applicants are making online applications. What's good about online applications? Well, we can receive applications earlier, and we already have the applications in the electronic format. So when we have to process the applications, when we have to vet them, our process will be faster. We will also try to use new technologies. For example, we are piloting the scrutiny of bank statements with AI. The AI will automatically show the figures or point the officer to the figures in the statement. We want to enhance our work efficiency so that staff members do not have to look for the figures themselves. Regarding the next question, I will ask Ms. Alice Lau to give you more information. Regarding support for preschool child or children, we do understand that for children with special education needs in the early stage, early intervention is key. It can help them move towards mainstream education. In the reply, it mentions one of the many support services rendered to these children. In recent years, we have been promoting school-based services, that is across different disciplines. In kindergartens, after assessments, and students with special needs. There are also students who are waiting for assessments or who are marginally in need of services. That's what we call Tier 1 or Tier 2 child support services. There's been a burgeoning demand in these 1 to 2 years. In Tier 1, the number rose from 3,000 to 10,000. For Tier 1, the number rose from the original figure in the pilot scheme to a regular scheme. Moving towards 2024 to 25, in this financial year, we aim to achieve no wait for these children so that they do not have to wait any longer. Ms. Eunice Yong, I'd like to follow up on 225 and 223. 225 is about abuse of spouses as well as children. In point 2 in my question, In 2024 to 25, within 10 working days upon receiving requests for family casework, the administration needs to contact the complainant. There's a decrease according to the reply, but the reply is silent on the reason behind it. It only mentions the success rate of cases that were responded to within 10 working days upon receiving requests for family casework services. Is that already the fastest time that the administration could get back to the complainant? Is 10 days appropriate? Can the administration reply or respond even quicker? In 3 to 5, I asked about the figures in relation to spouse abuse or child abuse. From 2019 all the way to 2023, there's an upward trend in the number of spouse battering cases or child protection cases. In light of this, what the administration is going to do in order to protect children. In number 6, the administration said that they would use big data as well as artificial intelligence AI to detect irregularities. In 2024 to 25, the new system, that is the new AI system, will also be introduced. Are there any child care centers piloting the use of this new AI system? Is the success rate high? Is it very effective? In the sense that the AI system can identify these cases, I'd like to first ask about the question about figures. Mr. Alex Wong, Deputy Director, can tell us more about the use of AI. Thank you. The 10 working days is actually the longest period at present. In case of domestic abuse or child abuse, we need to provide immediate support. We also need to get a hold of other family members in order to help them formulate the best social welfare plan. That is to prevent the domestic cases from happening once again. Within 1 to 2 days, we already visit the home. For other cases, we also request case officers to visit complainants within 10 days. That is to help them formulate a social welfare plan. In the past couple of years, there's indeed an increase in the number of child abuse cases. From 1,300 in 2022 to 1,400 in 2024. We are working on a bill, that is the mandatory reporting of child abuse bill. Professionals are needed to intervene earlier and identify these cases so that we can provide support to children being abused in no time. We have received a larger number of child abuse cases. We have also strengthened support for our colleagues in response to these cases. On technologies, thank you. Ms. Charmaine Lee, we are working with the OGO to launch an AI system to help residential care homes to detect child abuse cases. In December, we had a sharing session with the sector. We went to residential care homes for children and walked them through the new AI technology. We also sought funding, and we will launch this project in all residential care homes. It is expected that we can introduce this technology to all residential care homes in 2024 to 25. Next, Ms. Maggie Chan. Thank you, Chairman. I'd like to follow up on question 48. It's about a hotline provided to carers. That is the carer hotline. It receives a total of 12,957 calls. It operates around the clock. But the SWD does not have a tally of the figures, including the waiting time for callers or the number of times when the calls were hung up all of a sudden, as well as other cases. Actually, it's very important to have a good grasp of these figures in relation to care hotline. That enables us to have a better understanding of the situation. Is it possible for us to have a system so that these systems can operate easily for simple computation? Next, what about the shift hours of these social welfare workers? Are there any resources deployed to this scheme, to this hotline? Or does the $12 million cover the investigation and the follow-up work after the receipt of these cases? 3 questions, Secretary. Thank you, Ms. Maggie Chan, for your questions. 182, 183, this hotline has a couple of features. Well, we increased the number of phone lines to a total of 30. Even at its peak, the SWD only had 15 hotlines. On this occasion, we wanted the caller to have their calls picked up in the middle of the night. So we increased the number of phone lines to 30 in total. We did that on purpose. When the hotline has come on stream for a period of time, we can review the situation. When the demand is not high, we can reduce the number of call hotlines or the phone lines. Well, you said that you did not have any information about the waiting time, but then you're telling me the caller's calls are picked up immediately. Well, it's designed to be so. The Donghua Group has a lot of information about this. I understand Ms. Maggie Chan wants the public money to be used well. I'm not asking you about the design of the phone lines, of course. That is the ideal situation. But I'd like to know the actual situation. You don't even have the actual data. So how do you know that the caller's calls are picked up immediately? Well, Chairman, I look forward to more detailed reply in relation to figures. Well, we can supplement after the meeting. We can talk to Donghua Group. Any more follow-up? Well, regarding shift hours, we can ask Donghua Group to provide you with more information. Some volunteers are visually impaired. That's why they are especially sensitive to audio or to voice. They can sense whether the calls are indeed are in dire need of assistance. Well, I hope that the administration will provide me with statistics, figures, and the written reply. I want to have a good grasp of the situation and the effectiveness of phone lines. Well, the Secretary only wants to tell you more about the situation, so the Secretary told you a lot of volunteers are visually impaired as well. Next, Mr. Lam Chen Singh. Thank you, Chairman. I'd like to ask about 114 and 115. That's about the Strive and Rise program. A total of 30 participants have quitted the program. 16 tutors have already quitted the program. In the first phase, 149 participants failed to complete the program. Some participants were interviewed by the media. They said that the tutors were very busy. The visits were only to ordinary places, so it's actually difficult for participants to set their own goals. For sure, the Strive and Rise program is a flagship program that aims to alleviate poverty. We don't want it to not achieve the intended results. Some tutors work in the finance and banking sector. They take up a lion's share of the total number of tutors. So what about other tutors? What about other participants? When other participants can be paired with tutors that they'd like to work with, that would affect their incentive. There are thousands of quota for another pathway, but then only 100 or so have signed up for that pathway. Will you look into this situation as well? My second question is about 112. That's about the after-school care program. 59 schools are participating in the scheme. I'm looking forward to more schools taking part in the scheme. At least there should be some schools in each district providing such services. The administration said that some schools only take part in the scheme after the launch of the scheme, so you don't have a breakdown. But in Kwai-Ching District Council, there's a document detailing the information. That is, the Kwai-Ching District has a total of 480 places, but only 330 participants are joining the scheme. If the figures are correct, there's indeed some vacancy. Is it because of the too stringent requirement of the means test? Or is it the case that the families do not meet the financial requirements? Well, can you actually let them take part in the scheme so that more students can be benefited? Thank you.
Secretary, 3 questions. Thank you. Mr. Lam, Strive and Rise program. The first round of the program has already been completed for students of secondary 1 to 3 living in subdivided units. The program is actually very useful to them. For a program to be successful, of course, we need to listen to the comments, but I think that it's more reasonable or meaningful for us to conduct a study. Actually, a team from the Hong Kong U has conducted one, and we will announce the results in due course. But actually, the survey report shows that the Strive and Rise program help mentees who participate in the scheme to a great extent, and actually the mentors benefit from such a program as well. For the school-based after-school care service scheme, there is a means test, but I have to stress that the students actually receive such services for free. For those who do not pass the means test, they can still participate in the scheme, but they have to pay. When I visited or met with a student to participate in the scheme, some of them actually paid to attend the scheme. Next, Mr. Kenneth Lang. Thank you, Chairman. I would like to ask about 141. The Neighborhood Support Childcare Program. Paragraphs 3 to 4 in the reply, it is mentioned that to ensure the quality of the home-based child carers, the department is required to conduct home visit, and they will conduct also surprise visits. Is the measure in place since the implementation of the Neighborhood Support Childcare Project? And what do you look at when you conduct home visits? For people who join for the carers who join the project, will they be subject to more surprise visits? I would also like to ask about 143, the Strive and Rise program. According to paragraph 3 of the reply, it is mentioned that the number of applicants amount to about 4,544, number of applicants admitted 3,885, which means that the quotas have not been fully made use of. What is the reason for that? Do you have any measure to help applicants who could not join the program? Thank you. Secretary, I will defer to the director. Ms. Lee, please. Regarding training for home-based carers, they do have to undergo some courses and basic training. Apart from the 4-hour basic training, they also have to receive some professional training for an hour from a professional child carers, and we will conduct home visits. We will continue to improve the neighborhood support childcare project. Since fourth quarter this year, the training hours will go from 4 hours to 14 hours. As for the content of the training, that will be formulated by the Social Welfare Department. For home-based child carers, whether they are newly joined or they have been in the project for some time, they will have to go through a test. For carers who are capable of taking care of children of special needs, they will have to undergo another 4 hours of training. When we conduct home visits, we pay attention to the skills of the carers and their knowledge of childcare. We also look at the performance, their confidence level, and the environment of their homes, whether it's necessary to carry out childcare services. What about the Strive and Rise program, the quotas? The number of applicants and the applicants admitted are different. That's because some of the applicants are not eligible, and we are still conducting matching. We do have some requirements for female mentees. We want to match them with female mentors. Some mentors, if they are available and capable, we will match them with more than one mentees. Chairman, I would like to follow up. For mentees who cannot match with their mentors, can we follow up on them? Yes, definitely. The Polytechnic University is working on that for us. Next, Mr. Adrian Ho. Thank you, Chairman. I would like to follow up on LWB, bracket W, 242. That's Mrs. Regina Eep's question on the $2 scheme. For the fiscal year 2023, what is the actual expenditure of the public transport subsidy scheme? Is there any duplication with the $2 scheme? And will you extend the $2 scheme? Now, this $2 scheme cover coaches of residential developments. Why do these coaches or feeder bus of private residential developments covered? And what is the criteria for selecting these feeder bus? According to the government's reply, in year 2023-24, the subsidy to transport service operators amount to some $4 million. That is 3% increase compared to last year, or 30% increase compared to last year. Some franchise bus companies cut their short-haul service. As a result, there is this sharp rise on long bus routes issue. So does the administration have any measure to make sure that franchised bus companies who receive subsidy from the government provide a reasonable number of short-haul trips? The government have to maintain the sustainability of their finance, but we have to also ensure the interest of the passengers. Secretary. Some of the questions relate to the public transport fare subsidy scheme, and that's under TLB. I don't have relevant information. What about 242? For the $2 scheme, I will address the issue. They ask if we will take care of the section fares. We will address the issue. For the feeder bus issue, well, That was covered because of the demand from the people. Not all feeder bus of private residential developments are covered. The feeder bus have to be made available to not just the residents of that development, but also other people who live nearby. What about the franchised bus companies issue? Well, that's a public transport issue. I will relay that to relevant bureaus. That is the Transport and Logistics Bureau. Thank you. Next, Mr. Dominic Lee. I would like to ask about LWB bracket W 125. The usage of Community Care Service Voucher and Residential Care Service Voucher, CCSV and RCSV. For CCSV, some 8,395 vouchers were used. For RCSV, 3,433 vouchers were used. But in total, you actually have 10,000 CCSV and 4,000 RCSV. You mentioned that you will increase the number of CCSV to 11,000 and RCSV to 5,000. Why have the vouchers not used up? And you mentioned in your reply that you will extend the RCSV to cover also care and attention places. What changes do you expect that it will bring? And how will it change the demand of the vouchers? Well, I will ask the Permanent Secretary to reply. Ms. Lau, please. For eligible elderly persons, if they want to make use of money follow the user principle, then they can make use of the RCSV and CCSVs. After getting the vouchers, they may need time to identify a home that is suitable to them. For CCSV, elderly persons who get such vouchers may need more than one service. They will have to take into account the locations of the service providers and the kind of service they offer. So they may need time to identify the kind of service and the service providers that are suitable to them, and that is why the number of quotas and the actual number of vouchers dispersed may be different. As mentioned, we will extend the RCSV scheme to nursing places. We expect that the number of vouchers dispersed would be increased. For the waiting time of places of a higher care level, the time will be longer. So there could be elderly persons who are waiting for institutions offering care of higher level. They may be more interested to get the vouchers. I would like to follow up. You mentioned that the difference between the dispersed and the usage of voucher is because some of the elderly persons need time to identify the service that are suitable to them. But can we perhaps approve more vouchers than the quotas available? If we expect that 10,000 vouchers can be used, perhaps we can approve of 11,000 vouchers. Have you assessed the percentage of use? I completely agree. We already approve of more vouchers than the quotas available. As long as we receive eligible applications, we approve them. That is why we're confident that vouchers users don't have to wait. We need to accumulate data after implementing the scheme for some time, and we will report the results in due course.
I think Mr. Chen Yung, Lai Teng-kwok, and Charles Siu Chung may not be able to ask questions. Just to give you a heads up. Mr. Chen Siu Hong, thank you, Chairman. I'd like to follow up on the reply 239, that is the $2 scheme. A total of 12 members, me included, attach importance to this scheme. According to the administration's reply, in 2024 to 25, the expected expense is about $6.12 billion. And $6.01 billion for some modes of transport. Does it mean that the operating expenditure is about $110 million? If yes, comparing with the operational expenditure in 2023 to 24, back then it was $54 million. What is the reason behind the twofold increase of the operational expenditure from last year? My second question is that the administration would review the scheme as set out in the budget. It is expected that the review will be completed in 1 year. Well, I think the administration should base the review on figures and a widespread consultation. Any refinement, enhancement needs to take into account financial sustainability and the affordability. For example, the cap of 500, 1,000, or 1,500 per month. You also need to calculate the amount based on the transportation fares. I understand elderly persons can possess or they can use different kinds of autobus cards. For example, autobus cards that do not have the names registered. We also need to solve the problem of short rides on long routes. All senior citizens need to use Joyu card in order to enjoy the $2 scheme. Will you keep a breakdown and a tally of the transportation fares in the accounts of Joyu card in order to help your review? Questioned on two fronts. Secretary. Thank you, Chairman. I'd like to take some questions first. I thank Mr. Chen for giving us many recommendations. In our review, we will definitely modestly listen to members and the public. We need to factor in the original intent as well as the technological advancements. We want senior citizens to move around in the community. That will also be beneficial to their interpersonal relationships. We want to extend this very good scheme when the public finance can afford the scheme. Of course, statistics are necessary. On the 25th of August, all persons using the $2 scheme must use Joyu card. That will greatly help our work. But I can undertake that we can access all information in all cards. First of all, we need to think whether there are any privacy issues. But what I can see for now is that we can use big data, not just to help us with our review, but in the course of the implementation that will also be beneficial. Thank you, Chairman. Well, the Secretary's undertaking is very important. I don't want the Secretary to tell me once again in the replies that the administration does not keep a breakdown of the figures. The figures are actually very important. Operational expenditure, well, Ms. Charmaine Lee. Thank you, Chairman. There's a ratio between the amount and the reimbursement. In 2024 to 25, the ratio was between 1.6 and 2.6%, whereas in 2024 to 25, it's about 1.8%. That is on average. Ms. Nixie Lam, I'd like to ask about 3 replies, 121, 122, and 123. 121 is about the ethnic minorities ambassador pilot scheme. When it is extended or expanded, will that cover more people? What is the number of beneficiaries right now? Is there sufficient support for ethnic minorities? Is there any figure from longitudinal studies? Regarding 122, the Neighborhood Support Child Care Project, we need to conduct home visits, surprise checks in order to monitor the service quality. Is the service up to standard? If not, what is the ratio of satisfactory performance? Well, there are many complaints about child abuse, and you need to step up your monitoring and review. Is the administration financially capable of carrying all these out? In 123, that is the after-school care program for pre-primary children starting from 2024. Within 3 years, the program will be extended or expanded to different districts in phases. Isn't there a clear timetable for the 9 districts? Have you already earmarked all funding for these 9 districts? Or will you increase the provision at a later time? Thank you. I'd like to ask Mr. Alex Wong, Deputy Director of Social Welfare, to take the question. Please switch on the mic for Mr. Alex Wong. Regarding the support services for ethnic minorities, the number of ambassadors will stand at 46. We hope to expand the scheme. Regarding the after-school care program for pre-primary children, we'll take stock of the Neighborhood Support Child Care Project. It's being implemented in a couple of districts. In the coming 3 years, we'll expand the scheme to the remaining 9 districts. We are collecting data to see which district should be accorded with priority. We will have to tap the community about the service demands in order to decide the priorities. Well, what about sufficient support? Well, don't just look at the question. Please listen to me carefully. I mean, is there any sufficient support? You haven't yet answered my question. My second question relates to resources. If we need to enhance the depth on the Neighborhood Support Child Care Project, is there a sufficient resource? You haven't yet told me regarding the timeline for the other program, which 9 districts should receive priority. Are the funds already? Well, the administration did not answer me. You only told me 3 years. Anything to add, Mr. Alex Wong? Thank you, Chairman. Well, as I mentioned, we will increase resources. Regarding the incentive payment for home-based child carers as well as training hours, we have already sought resources to step up training, whether before service training, assessments, or post-service follow-up. We have already increased resources. Well, my question is whether you have sufficient funding. That is because of the burgeoning demand from the community. So do you have the financial resources to meet the demand? Well, Ms. Nixie Lam asked a series of questions. Probably the administration did not catch the drift of your messages. Well, maybe the administration can provide a written reply. Yes, listen to my question once again and you will understand what I'm asking about. Next, Ms. Connie Lam. Thank you, Chairman. I'd like to follow up on a question asked by Mr. Chen Yong. That is 056. That is a pilot scheme on supporting elderly and carers together with community care teams. Secretary, there are many suicidal cases relating to carers. At the end of March, there was a pilot scheme on supporting elderly and carers. The community care teams were deployed to help. So, why was the scheme only implemented on a pilot basis in Chunwan and the southern districts? Other districts also matter. The pilot scheme will run for 1 year. Will you review the scheme as soon as possible? Well, I understand the care teams are not under your purview. They are under the HYAB. But I'd like to see training being conducted at the same time, visits being conducted at the same time. Why is it difficult? Why is it so difficult to train and to carry out the scheme together with the other 16 districts? Actually, we shouldn't waste any more time in helping carers. There are many suicidal cases. Thank you. Community care teams were first set up in the Chunwan district and the southern district. We wanted to step up support given to carers of singleton elderly persons and doubleton elderly persons. The pilot scheme was to run for 1 year. We hope that the pilot scheme will give us necessary information we were looking for. With the information at hand, we will be able to roll out the scheme in the remaining 16 districts. I'm glad to hear that the care teams of different districts are also willing to work with us. Well, the Secretary did not answer my question. My question is, why are you not going to keep reviewing the scheme? There are only 2 districts where the scheme is being conducted on a pilot basis. Why don't you train all the care teams, all the helpers in different districts? As you see, there are many tragedies, like the one on Beacon Hill. Secretary, we want to make enhancements where necessary, and we can carry on with what we are already doing well. So we want to take some more time to take stock of these 2 pilot schemes. Then we can review them, we can make enhancements before we roll out the scheme proper in other districts. Well, Secretary, does that mean that there's a manpower crunch in the SWD? When I see many suicidal cases every day, my heart sinks. I don't want to see any more suicidal cases. Well, there are many ways for us to collaborate with care teams, but when it comes to home visits to detect needy cases, we do need to walk through the entire procedures. Well, we have tight manpower resources, but if we need to do our job well, we are more than willing to do so, even if that means we have an increased workload. But we do want to try out the best methods, and we want to carry on with the project with the best method. Mr. Stanley Lee, I have asked a total of 16 questions from 147 to 164. 1,457 cases were about child abuse. This is not ideal. It's not satisfactory. I hope that after the SWD has step-up inspections, that's exactly why you identify more child abuse cases. If this bill is successfully passed in the Legislative Council, there will be a transitional period of 18 months. I want to know how the transitional period will help us detect, identify, or prevent child abuse cases in society. Next, about residential care homes. Some elderly persons would like to retire in the mainland or the GBA, but then many elderly persons also would like to retire in Hong Kong. The approval mechanism for imported labor is quite slow. How can you expedite the mechanism in order to make sure there will be a sufficient supply of labor? Next, many members asked about care teams. There was a carers group. We are worried about a serious manpower crunch of the SWD. If that is the case, can we allow care teams and NGOs? They can directly gauge whether the cases detected by the care team should be referred. My last question is whether the scheme can be extended to the Guangdong scheme. Thank you.
Secretary. First, regarding the mandatory reporting of child abuse bill, after passage of the bill, there will be an 18-month transitional period. But it does not mean that we will not handle reports during the transitional period. There is heightened awareness on child protection in the society, and we receive reports via various channels on child abuse. Upon passage of the bill, we hope that there will be even a stronger awareness on child abuse, and we will step up publicity. For care workers of residential care homes, we have a special scheme to import labor. We know that the residential care homes are well aware of the procedures. When the special scheme to import labor were transferred from the Labor Department to the Social Welfare Department, there was some challenges, but now the residential care homes have gotten used to the procedures. I've met with all of the district councillors of the 18 districts and the members of the care teams. We have told the hotline, the mobile phone numbers even of the social welfare groups to the members of the district councils and the care teams. If they come across any cases, they can relate them to the social welfare groups. Chairman, there are 2 districts that are under the pilot scheme, and I know that the cases will be transferred to the Social Welfare Department for evaluation, and then the NGO will be providing services to the people in need. Why do you not refer the cases directly to the NGO instead of going through the SWD? Director. For this pilot scheme, we want the care teams to better understand the case, and that is why we want the case to go to the social welfare officer first. This is just a pilot scheme. If we realize that the care teams are actually very capable to take care of these cases, then we will not rule out directly referring the cases to the NGOs, and we will bypass the social welfare officer in the future. Next, Dr. Wendy Hong. I would like to follow up on 73, 75, and 78. And there is an increase of 50% of expenditure on social welfare sector, and some $100 billion are spent on such social welfare sector every year. I have some questions. If the secretary cannot take all the questions, then please reply in writing. Now, the cost spent on social welfare department increased by 13.3%. The financial secretary said that the rate of increase on the expenditure will decrease to some 2.2%. Do you think that the prediction by the Secretary for Financial Services and Treasury is likely? For spending on OH allowance, OH living allowance, the Guangdong scheme, and the Fujian scheme, the total sum spent on these schemes amount to $44 billion. This accounts for about 62% of the total spending of the Social Welfare Department. What is the rate of increase for the expenditure of these schemes? And the administration replied to me saying that they cannot make such a projection. I don't think that they cannot make the projection, but the projection would be very staggering. Now, for the rate of increase for OAA is 10.4%, OALA 17.8%, Guangdong scheme 38.6%, and Fujian scheme 31.3%. I think that we have to spend some billions of dollars on OH allowance in no time. Now our population structure is in an inverted pyramid shape. There will be more elderly persons than young people in the future. We need a structural change. Otherwise, the young people will not be able to take care of the senior citizens in the future. My third question. For the self-reliance program, there's some 274 people receiving CSSA. There are only 15,000 people times who have participated in the support for self-reliance scheme. That accounts for about less than 5%. What is the effectiveness of the support for self-reliance scheme? The administration said that only 351 people who could join the workforce, which account for some 0.1% of the total recipients of CSSA. What is the cost effectiveness of the support for self-reliance scheme? We've spent $160 million on the NGO for provision of such a scheme. We accord some 32,000 for each NGO, which means that each participant of the scheme are subsidized with $412,000. That is even higher than the subsidy provided for these people by CSSA. I don't think that this is acceptable. As I mentioned in the opening remarks, you have spent more than 3 minutes asking questions. Please choose one of the questions to address. Secretary. Chris, the Secretary for Financial Services and Treasury, said that the increase of expenditures on complement with the growth of economy. And Dr. Hong is aware or realize or is of the view that the spending on social welfare sector is substantial. Our cost account for about 1/5 of the total expenditure, but that is actually reasonable because most of our users are senior citizens and we are faced with an aging population. Next, Mr. Chan Pui-lan. Thank you, Chairman. I would like to follow up on number 55 about the Guangdong scheme. I will not repeat the questions put by other members. For this residential care service scheme in Guangdong, people don't have to wait before they can reside at residential care homes in Guangdong. For the expenditure in 2024-25, that's a slight drop compared to 2023-24. The Secretary said that they are identifying more places and residential care homes for the scheme. Now, the demand is greater than the supply for such a scheme. Why are you identifying more residential care homes for the scheme? Are you trying to provide the people with more choices? What measures do you have to encourage more people to actually reside at the care homes under the scheme? Secretary, thank you. Mr. Chan. It's difficult for us to ask senior citizens to leave their comfort zone. They have to be comfortable with the medical services provided, and they have to make sure that their relatives can visit them very conveniently. We want to provide more choices because we only have 2 care homes under the scheme. We may identify care homes outside Shenzhen and Shaoxing. Some people may be from Zhongshan and other cities in Guangdong. If we can provide them with more choices, then they may choose to reside in the residential care homes in other cities. For the 2 residential care homes under the scheme currently, they are NGOs. There could be other operators of residential care homes. They may be from the private sector. More people may be more willing to choose those residential care homes. If we can provide more choices to them, then more elderly persons may choose to retire on the mainland. One more question. What if no one resides in the residential care homes under the scheme? Do you still have to pay? Well, no, we don't have to pay them. If no one is participating in the scheme, then we don't have to pay anything. That's pretty much like the bought play scheme. Mr. Chikokan, I would like to ask about 2.202. That is the Job Training Program Integrated Vocational Rehabilitation Service Center. The cost, number of applicants, the Social Welfare Department said that they don't have figure on such areas. We have no way to scrutinize, and we don't know how to assess the cost effectiveness of the program. There are some parents of children with special needs who told me that the places for the Integrated Vocational Training Center are very few, and that is why the children of special needs become unemployed after they graduate. Some of the people who are working at the day service center actually work on preparing plastic packaging, and now we're going plastic free. There are even fewer job opportunities for them. How do we support this group of people? I would also like to ask about 112 and 193 about the after-school care program. There are some schools that offer very few places. A school offers as few as 8 places. When we decide to accept which school for the program, should we also take into account the number of service places offered by them so that we can be more cost effective? The program only take care of or look at the figures at the district, but they don't look at the number of service places offered by a single school. Secretary. For persons with special needs, we offer different services. We have sheltered workshops, for example, for them. The government dedicated a large sum of money on rehabilitation services. We understand that every needy person wants a better service. We will try to improve on the capacity of the service that we provide. Regarding after-school care program, this is just a pilot scheme and is positively received by the participants. We will look at the results of the pilot scheme to see if we will expand the scheme. We have been in close liaison with the schools that are participating in the school-based after-school care service scheme. We pick schools with students that are in need, even though the service places may not be a lot, but as long as there is a need, we try to include those schools under the scheme so that we can maximize the number of beneficiaries. Chairman, I would like to follow up. Will we adopt this user-paid principle so that ineligible parents can pay to enjoy such a service under the school-based after-school care service program or scheme, as we have service places that are not used? If schools from all 18 districts participate in the scheme, then parents of all 18 districts can benefit.
Thank you. Yes, for one of them, we are already implementing this, while for the other one, when there's a lack of quota, we are according priority to needy families. The remaining can still take part in the scheme, but they have to pay. Of course, if it is successful, we can extend the program to all 18 districts across Hong Kong. Mr. Andrew Lam, I'd like to follow up on the reply 126. It's about the street sleepers. There are a total of 1,500 street sleepers in Hong Kong, a 1.5-fold increase from the time in the past. That is 10 years ago. In the reply from the administration, in the past few years, for example, last year, there were 600 or so support cases. They accounted for some 40% of the total number of cases. There was only an increase of 6 places in the residential care homes. Apart from that, is there any more support you can give to these street sleepers? Have you thought about what you can do in order to reduce the number of street sleepers? 126. Miss Charmaine Lee, thank you. Social welfare services are one of our focuses. We have already commissioned NGOs and outreach teams to reach out to street sleepers. There are many reasons why they choose to be street sleepers. Whether they accept our services, this is also a factor at play. Sometimes, time and again, when we persuade the street sleepers, it's actually still their choice. Member mentioned a small increase in the number of residential care home places. We are already doing our best. We also need to have regard to the situation of street sleepers. We need to have a cross-departmental force to work on the reduction of the number of street sleepers in Hong Kong. Well, you mentioned there needs to be a working group covering different departments. So which department or departments do you want to solicit their help? I'm not criticizing you, but this problem has been around for some time. Do you have any plans to reduce the number of street sleepers? You also mentioned a cross-departmental working group. How can I help you? Well, when I said cross-departmental, probably we need the help of the SWD as well as the Home Affairs Office. The teams can reach out to street sleepers if they need emotional support or if they have family issues. We can also refer these cases to integrated family support centers. We can also talk to the Housing Bureau or the Housing Department to see whether there are any transitional housing available for these street sleepers. Dr. Hui Simon Lee, thank you, Chairman. I'd like to follow up on my question 135. In the reply from the administration, they said that they did not have a tally on the child care services or the number of young children in Hong Kong. Well, If there is no such information, how can you balance the supply and demand to make sure that there won't be any oversupply? We need to have regard to the district situation in order to deploy resources in a better manner. We need to have a rough grasp of the situation or circumstances in different districts. I have researched into different districts. From the Census and Statistics Department, we can collect some data, after which we can also use the data to derive some findings. From a Legislative Council Research Unit paper, I have actually got hold of such figures. So probably we can get these statistics from the Census and Statistics Department. That is to make sure that there won't be substantial imbalance in between the supply and demand. Between April and December in 2023, the number of childcare services for children aged 0 to 2, the figures do vary quite substantially. In the Eastern District, the number was 375, whereas in Wong Tai Sin, the number is only 30. So what kind of measures do you have in order to solve this problem? Ms. Charmaine Lee, Director of Social Welfare. Thank you, Chairman. When planning childcare services in childcare centers (CCC), we are complying with the Hong Kong planning standards and guidelines. Per 25,000 population, we provide 100 subvented childcare service places. We aim to achieve this in new development areas. We can earmark suitable areas for this purpose. But as members said, we also need to factor in the land supply situation as well as the utilization rate of services or other services. Mr. Alex Wong, let's see if the Deputy Director has anything else to add. In 2020, per 25,000 population, there are 100 childcare services or childcare service places. That is according to the Hong Kong planning standards and guidelines. For some projects, they have been included as well. If there are new developments or new projects in the future, the number of childcare service places will also increase correspondingly. In relation to the housing project as well as the population in Hong Kong, we will adopt the standards in our development of new projects. If we only use 25,000 as the base figure in older districts such as Wong Tai Sin, where the population is aging, the service demand in this connection is not that great. So we'll have to take into account the number of places to be added in different districts. Mr. Chao Siu Chung, thank you, Chairman. Actually, my first question is actually similar to Dr. Hui Simon Lee's. That is 61. There's a serious dearth of childcare service places. I go along with the idea of unleashing the potential of women. We should allow them to return to the workforce. That's a crucial stage for them to advance their career. So the government should step up resources provided to children aged below 2. That is in order to help unleash the potential of women in terms of their employment. Wong Tai Sin and Tuen Mun see the most serious aging population. As the government mentioned, in the coming 3 years, the 10 childcare centers being added do not cover the two districts, that is Wong Tai Sin and Tuen Mun, where there is significant imbalance. Why is that? My next question is about 064. In 2020, the SWD applied from the Legislative Council for a total of $200 million to purchase social welfare equipment or services. They aim to purchase 120 premises. That is to have at least one childcare center in each district. They also aim to provide daycare centers. At present, we only have 5, whereas the target is 112 premises. The target back then, is it still applicable? In our consideration for purchasing properties, premises, should we identify suitable premises to develop them into childcare centers? Thank you, Chairman. The administration has responded to the first question in a brief manner. Any more else to follow up? Secretary, we want to use the amount of money well, that is $200 million. Indeed, there are significant restrictions. For example, the height of such centers is broadly below a certain limit. We'll try to address the situation and look for more suitable places. Ms. Lee? We base the number of childcare service places on the Hong Kong Planning Standards and Guidelines. Member mentioned Tuen Mun and Wong Tai Sin. They've not been covered in the 10 new subvented childcare centers to be set up in the coming 10 years. Member asked why there are none in the Wong Tai Sin and Tuen Mun districts. Well, we need to consider the land supply situation in that district and the ratio of private market or privately subsidized premises and government subsidized premises. Through different development projects, we'd like to increase the number of child care service places. Next, Mr. Lai Tong Kwok. Thank you, Chairman. I'd like to follow up on 242. Just now, Mr. Adrian Ho already asked the Secretary about this question. As we know, the administration has already announced that it would review the $2 scheme to make sure that they can better use resources. Just now, Mr. Adrian Ho asked about the subsidy scheme by which the public transportation fares can be subsidized. As long as they use Octopus card to take public transport and the monthly transportation fares exceed $400, then they are eligible for the refund. For senior citizens aged 60 or above, the Joyu card they carry with them is also the Octopus card, so they can also claim the subsidy. Let me give you an example. Nowadays, many people go to the mainland. Well, will you take the MTR to Lo Wu through the Lok Ma Chau Spur line? Some may even want to take first class compartments on the MTR. So sometimes they may reach the threshold of $400. Is there any overlapping between these two schemes? When you think about how to make better use of public money or public resources, will you include that in a viable plan? Just now, Dr. Wendy Hong also asked about the operator of residence bus. Is residence bus service only run between the place of residence to a public transport interchange, for example, an MTR station? Or from a place in, for example, the New Territories, all the way through to Central? Thank you.
第一個問題
Secretary, thank you for your questions. I now understand what Mr. Adrian Ho was talking about. I know that both of the schemes are under review. We can work better with the Transport and Logistics Department, or BIROC. It's very difficult for people to reach the 400 threshold by making use of Joy U card. You have to take 80 trips per month. We will work on that with the Transport and Logistics Bureau. I will see if the Commissioner of Transport will have further information on the resident service operators. For the residence operators or resident service operators to be included in the $2 scheme, there are some criteria. The service have to be open to other people on top of the residents of the private residential development. When the Transport Department scrutinized the application of resident service, we already assessed that criteria. Mr. Lai, any follow-up? What about my second point? There are buses who bring people from New Territories to Central. Are they included? Ms. Lee? I think that you're talking about franchised buses that cater to employees of a company, but we only include actually resident services. Thank you. Next, Mr. Chan Yong. I would like to ask about my questions 57 and 59. The administration gave some very detailed reply. For the Guangdong scheme and Fujian scheme, will you actually roll out schemes for other provinces as well, so that we can better review the effectiveness and provide more choices for interested senior citizens? Regarding reply 59, there are 7 more care homes that are available for voucher users. If we want to increase the demand, do we have resources to provide more choices for interested elderly persons to retire on the mainland? Secretary. Thank you, Mr. Chan. Let me take the second question first. As long as people are willing to join the residential care services scheme in Guangdong, they can join immediately. When we have more operators under the scheme, there will be more choices. As I've explained earlier, the scheme is like a bought place scheme. As long as the care homes are willing to offer places, we include them in the scheme. Regarding the Guangdong scheme and Fujian scheme, will we extend the scope to other provinces and municipalities? Well, we should work on the Guangdong scheme and Fujian scheme first, because the number of participants are rather significant. We cannot just expand the scheme. We have to monitor the schemes very closely. As you've noticed, we have engaged a very capable entity to monitor the effectiveness and the effectiveness of Guangdong scheme and Fujian scheme, so we don't have a plan to expand the scope yet. Thank you. Next, Ms. Lilian Kwok. Thank you, Chairman. I would like to follow up on reply number 5 on Shine Skills Centers. I know that you offer some 1,060 courses and events to the participants, but only 339 cases were being followed up on, or only 300 and odd people actually are employed. How do you follow up on these participants so that they can actually get a job? I would also like to follow up on reply number 107 about the navigation scheme for young persons in care services. From 2020 to 21, the expenditure is about $100,000, but for the revised budget in 2023 to 24 is $82 million, and the number of admissions is 225, which means that you spend some 360,000 on each admitted participant. What is the reason for that? For after-school care program, we have dedicated much resources, and we also have a after-school or school-based after-school care program. Can we not consolidate or rationalize all these after-school care programs? Children and students who benefit are of similar background. To make better use of our resources and to save administrative costs, can't we rationalize all these after-school care programs? Thank you. 3 questions, Secretary. Chairman, I would like to ask the Deputy Director, Mr. Wong, to take some of the questions. Regarding after-school care program and the school-based after-school care program, well, I share the same observation. We have after-school care program for pre-primary children, for primary children, and school-based after-school care program. These programs allow students to stay at a place that they are familiar with after school, to engage in meaningful events, activities, or finish their homeworks. Now we have expanded the scope from 50 schools to more. For community-based after-school care program, we will try to include the elements in these programs to the after-school care program that is school-based. Let me give you an example. For the community-based after-school care program, we do have an enhanced version of it. The number of service hours is longer under the enhanced scheme. For the school-based after-school care program, there is limitations on the number of service hours because of the opening hours of the school. After the completion of the pilot project, we will see how we can link these 2 schemes up better to make better use of resources. What about the issues on Shine Skills Center and the expenditure? Regarding reply number 107, the navigation scheme, I will see if Mr. Wong have information at hand. If not, we will provide supplementary information after the meeting. No. Then please give us supplementary information after the meeting in writing. Last member to speak, Mr. Shanghai Long. Thank you. Secretary. Well, thank you, Chairman. I heard that the Secretary said that the Social Welfare Department has dedicated much effort and resources on the social welfare sector. And I know that the social welfare sector has to sustain a 1% cut in terms of their expenditure. For NGOs with $50 million of funding allocated, they have to cut their expenditure by 3%, for example. We have to look at the effectiveness of spending of social welfare. I would like to ask about 100. That is Reverend Kun's question on the Strive and Rise program. $117 million have to be spent on the program, according to the administration's reply. The program recruited 2,800 mentees, which are who are junior primary school students. That is 21,000 people benefit, which means that we have to spend 42,000 per student. For the figure of 2,800 mentees, is that too low compared to the total number of disadvantaged students in Hong Kong? For the mentor to mentee ratio of 1 to 8, is that reasonable? How do we increase the number of hours that the mentor spend on a mentee? Secretary, I will ask the director to explain. Ms. Lee, please. For the $117.8 million that we mentioned, we're talking about 2024 to 25 estimated expenditure. That's for phase 2 of the Strive and Rise program. For the phase 2 of the Strive and Rise program, we have 4,000 mentees. And we also have to spend on the alumni club. The alumni club is for the graduates of the first phase of the program. The $117 million are not the cost we've spent on the 2,800 mentees. For the matching of mentors and mentees, under the first phase of the program, that ratio is 1 to 1. For phase 2, we will improve the ratio because some mentors told us that they want to match with more mentees and they want to organize small groups activities. That is why we allow a mentor to take care of more mentees in the second phase. And there are some mentors who are taking care of 2 mentees, for example, in the phase 2 of the program. We ask the mentees and mentors to exchange for more than 12 times and have more than 12 interactive sessions within a year. Any follow-up? No? Then we conclude this session. The next session will start at 4:10 p.m. Thank you.